Uh, Very excited about all the participants. So many people on a middle of the day during the week like this to join something like this. So this says a lot. Um, so I'm going to jump right in, and I'd like you all to just imagine a child, bright, full of potential, eager to learn and explore. Now imagine that same child carrying an invisible weight, a burden that they never chose. It could be the echoes of trauma, the silent struggles of anxiety, or the overwhelming fog of depression. These battles are often fought alone, unseen by the world around them. Mental health is not a luxury. And I like to underline that. It's not a luxury. It's not an afterthought. It is the foundation upon which a young person builds their future. Yet far too many children and adolescents are struggling in silence. Their pain dismissed as just a phase of childhood, or they have to hide it behind a brave smile. The truth is, trauma, whether it's from adversity, neglect, loss, or unseen pressures, leaves lasting imprints on young minds. And that's what we are realizing more and more with the level of science and knowledge that we have, that these struggles, these traumas leave lasting imprints. But what we must remember, though, is that trauma is not destiny. With the right support, the right interventions, the right understanding, healing is possible. Today, we're here not just to talk about the challenges and the struggles, but also to illuminate a way forward, a path built on awareness, compassion, and action. And that's where I want all of you to be empowered, because I'm feeling more and more in terms of what I'm seeing that it's going to require each and every one of you, each and every one of us, to provide the leadership for government and for others in the general society to follow. When we prioritize youth mental health, we don't just change individual lives, but we change our collective future. And so, again, I thank all of you for being here, and I hope you find this exciting. And I want to go as smooth and as fast as possible because I'd love to get feedback and questions. So, we're going to talk a little bit about where we're coming from. We're going to delve in and cover some of the progress achieved. We'll touch a little bit on where we are now and some of the challenges, what we do know and understand from the collective amount of information that we know, and also turning the tide of it in terms of where we want to go. So let's go back a little. Let's go back 80 years or so to a sleepy little fishing village, in a sense, called the Cayman Islands, where we have our three islands with approximately 6,000 people at that time. We had uh, very little activity. So a lot of this information I got from, as you can see on the background of this slide, the British Colonial Register, which was the British colonial government's way of obtaining information in a sense, and they provided this register on all the overseas territories and colonies. And it's interesting that the register, one of the things it highlights, and you can see at the end of that picture there on the slide, was that the island suffered greatly from a lack of recreational activities for the residents, and in particular for the children. So we had no hospital or treatment facilities for mental health. So they highlighted there in this 1943 register that the most mental health cases were hidden, were kept here on island out of view. Families tried their best to manage those with serious mental illness, those that were wealthy, which were a very small minority, were able to take their family members by boat to Jamaica. But many others, again, had to hide their symptoms and pain. Those that were taken to Jamaica were sent to Bellevue Hospital in Jamaica. And that's the first theme I wanted to hit on, that from very early on, it was the norm to send our mentally ill away and primarily to Jamaica to be treated and kept there. Between 1940 and 1946, during World War II, a large percentage of the males in the Cayman Islands were overseas. We have our seafaring history, so that's been a major component of who we are. But then that highlighted again a certain separation of families because the men were at sea. The women had to lead and take on greater roles, and that also highlights another component of our culture where we've had strong maternal or matriarchal type approaches to managing the family. So between 1940 and 1946, the few activities that were started, usually by the churches, it was the Church of Scotland that first came and set up a girls' guild and set up the scouts and things of that nature. Those things were shut down also during that period of time because of the war. And the men that did reside in the Cayman Islands were basically occupied looking out and providing security and supporting those that were here. Another point, though, if we look at that, is to highlight that very early on, our forefathers realized that there needed to be activities and socialization for our young people. So there was a festival of youth in December 1947 that was shortly after the war. And that led to where there was actually even a girls' guild carnival in May of 1950. So very early on, before we had electricity, when we were struggling and life was quite harsh, and we've heard all the stories about the mosquitoes and the difficulty here. I wanted to highlight that the adults realized that young people needed interaction, needed socialization, needed outlets. So very early on, those were established. And again, the second point I want to highlight again, addressing mental illness directly was not something that was done. And a large part of it was because we didn't have the infrastructure. So early on, the pattern was set that we would send those with serious mental illness to Jamaica or overseas. Now, that brings us to the severe challenge of caring for the mentally ill. It was not until very recently, just in the last 20 years, that we've actually even had mental health beds or places to treat those with severe mental illness or those with even moderate level of mental health challenges. We used to use the police lockup to treat those that had severe breakdowns or challenges with illness. In 2016, our former Commissioner of Police, David Baines, opened the Fairbanks cell block for the first time, and he said it replaced what we had called the cages, which were the names for the Georgetown lockup and the West Bay lockup. And the conditions in those facilities were abhorrent, were terrible. Temperatures rose to over 100 degrees. Many UK experts that had come and analyzed, especially in the late, over 10, 15 years ago, said that it was really tantamount to torture having people kept in those conditions, let alone keeping people with medical illnesses or mental health illness locked up in those kinds of conditions because we had no other facilities. It was not until 2003 that we got the first inpatient hospital beds for psychiatric patients or for those with mental illness at the Georgetown Hospital. So that was in 2003. And at that time, we had started with 8 beds. Prior to that, as I said, those with severe manifestation of illness were actually kept in the lockup. Those that could be managed more reasonably were managed on the medical ward. I remember treating people on the medical ward and they would walk away. That was the challenge. Or as soon as they felt a bit better or they were able to move around, it would be hard to contain. So yeah, it was very challenging. Now, this is not a talk about focusing just on the negative or what we're lacking, but there has been progress. A lot started in 2001 with what was called the Bradley and Palmer report. So Bradley and Palmer were, one was a psychiatrist, one was a lawyer from the UK. They were commissioned by the Ministry of Health at that time to come to the Cayman Islands, assess the mental health framework, and to give advice on ways and areas that we could improve and adjust things. They prepared a wonderful document that was hidden away and lost for about 10 years or so until several of us on the mental health task force that you see in 2010 dusted off that document, took the advice, and that document gave guidance for such things as the Mental Health Commission that we have today. That document gave guidance on providing rights to those with severe mental illness so that they weren't just locked away at the whim of authorities in the jails and cells, but they had options to appeal, that treatment was provided, that the care was brought up to the 20th century at that time. As you can see, our inpatient unit was opened in 2003 with 8 beds and several other things. Drug and rehabilitation courts in 2011. We had a comprehensive children's law for the first time in 2012. Our Human Rights Commission and the Human Rights Commission law was only enacted in 2012. Progress has continued in 2013 with the mental health law and the mental health commission. We had the disability policy. As I said earlier, the custody suites were opened in 2016 so that those that were detained for certain criminal activities, or even those that were detained with criminal activities and had serious mental health issues, could be housed in a more humane fashion. The Alex Panton Foundation was started in 2018. The Older Persons Law. We had our first group home open in 2021. And Alex's place, the Adolescent Mental Health Hub at the hospital, was just open in 2023. What you're seeing is from 2001 to the present is where we've had the most change and growth in terms of development of our mental health system and understanding of what is required to progress. In 2024, we finally had the opening of the Ponciana Rehabilitation Center, and I'd like to comment a little later about some fantastic news that I just received about that facility getting an international recognition. And in 2024, I highlighted this in red on this slide, we had a gathering of over 300 young people from all the schools on the island. It was called Inspire, a youth meetup to speak out It was a unique and novel experience, and we gained a tremendous amount of experience in terms of, for the first time, having the youth come together and us as the adults, as the professionals, as the carers, listening to them and hearing what their concerns, desires, and needs are and were. Where we are now is that we have gained a lot in terms, as you have just shown, in terms of developing our law, developing different options and mechanisms to gather information. There's several other NPOs I did not add because when I did this talk, they weren't there. For example, there's now a special needs or inclusion NPO. There's several other NPOs that have opened up to support mental health in the Cayman Islands, and we need everyone on board. But there's still some areas that are lacking. When it comes to our inpatient care, and it is a needed and valued component of a mental health system. And it's very important that I underline that a mental health system is as complex as any other form of a medical system. You can't have the hospital without the emergency room or without the ICU unit or without a pediatric department. Those are all valuable areas that contribute to the overall medical system. Our mental health system is the same and requires an inpatient acute unit. That inpatient acute unit cannot be a one-size-fits-all. Recently, just in the past weeks, we've had a 9-year-old child on that unit where we've had adults, people in their 40s. We've had teenagers. We have a gentleman that's been living on the unit in the hospital for the past 5 years. He was declared not guilty by reason of insanity many years ago. And the law, as it stands, states then he should be transmitted to the hospital or a mental health facility and to reside there until it's then determined by the governor that he is fit to be released. So this gentleman's been living on this unit in the hospital for 5 years, and we've had 9-year-olds, 12-year-olds, 13-year-old children mixing with others going through other serious illnesses. That's not right. That should not be happening. Mental health, it's not a one-size-fits-all. We would not put children from the pediatric unit on the general medical ward or on the surgical ward. We would not put a woman going into labor in the ICU unit or to have her deliver in the emergency room. There is a reason in medicine that we have these separate types of approaches because we've realized from decades of work and information that people do not thrive and respond in those types of situations. Adolescents make up about 50% or more of our daily census on the inpatient unit at any one time, with overdose-related or suicide attempts being more common than ever. Last year, we had the highest amount of suicides in the history of our islands. We were about 8 or 9 suicides in 1 year, and that is extremely high for our small population. And it's showing a very troubling trend, a trend that we're seeing around the world, but a trend that we're not immune to. And that highlights the need and my passion behind giving these types of talks and also empowering each and every one of you that's watching this, that you have a voice and that the only way things can change is actually hearing your voice, not mine. Mine is getting tired and it's being criticized at times. But I'm not going to stop, but I need your help to speak up, speak out, make a post. Things when it comes to different days or mental health days and challenges. I noticed that some of the media houses are bringing in psychologists to talk on radio or people that have lunch and learns like this. The more, the better. All of the NPOs, I want to empower all of you to keep talking and bringing up information. This is about saving our youth, saving our next generation, and saving those of us adults that have challenges with mental health. What we do know is that and I love this quote from an old psychologist. He said, the best way to understand something is to try and change it. And, and I've seen that several times through my career, especially when we're trying to change something for the better or fix it. That's when opposition starts, that's when criticism starts, and that's when you really start to understand the complexities of whatever we're trying to change. The impact of mental health is significant on young people, and it's even more significant now in this age of technology and the age in which we're going into, where technology is now becoming even more a more dominant force in the AI generation or time period that we're moving into. 50% of all lifetime cases of mental illness begin by age 14 and 75% by age 24. I want to repeat that. At least half of all diagnoses of mental illness, even if they're made when you're 40 years old, when we look back at the history and look back in the details, we find that there were symptoms or features by about age 14, for at least in half of those cases. And by age 24, at least 75%. The sad stat, though, is that it takes an average of about 10 years as the average time from the start of symptoms to when there's an intervention. So think of that if you had high blood pressure or diabetes and you've been having symptoms for 10 years before there's any intervention. And I'll even throw out something a little bit more ominous. Suppose we had a diagnosis of cancer and we took 10 years before it was ever recognized. How many survivors would we have today? 50% of students that are untreated, that have mental conditions, especially diagnosable mental disorders that are untreated, drop out of school. So again, and I said in the first time I gave this talk, and I always repeat it, I know I'm biased as a psychiatrist, but I feel that there is no health without mental health. You cannot engage in any other part of medicine with any other physician, follow their instructions, be compliant or adherent with medication and treatment if you do not have your mental faculties. And so you can just imagine if the burden of mental health that we're talking about lays heaviest on young people and it's affecting their cognition. And number two, the young brain is still developing. Imagine the impact on schools, on attention, on their retention of information. So I want to highlight something quickly. Recently, in the last few months, there were even concerns or criticisms about our diagnosis of ADHD or attention deficit disorder or other diagnoses in young people, that we're overdiagnosing, that we're over-medicating. I'm going to tell you something as a psychiatrist. I don't like to write medications. I don't do it for fun. I don't hand out prescriptions. Each prescription that has my name on it comes with a responsibility and a risk. A responsibility and a risk. So anyone that thinks that doctors are handing out medications because we like to, especially the children, you need to really check that and understand. The next thing is when we jump and say that things are being overly prescribed, let's slow down and look at the recognition. We have gained a lot, as you saw a few minutes ago, in the last 20 years, in terms of just recognizing the impact of mental health conditions and illness. We've only now in the last 20 years started to have things like the Alex Panton Foundation and have lunch and learns like this and learn about the impact of mental illness. So don't criticize and blame us for recognizing and identifying illness. We don't criticize where breast cancer is. I remember 25 and 30 years ago, breast cancer was something that was hidden. It was secretive. The rate of death was extremely high. Women took that on and a lot of support from others. And there were marches and walks and information, and money was gathered for treatment interventions and early recognition. No one criticizes that and says the numbers are higher because we've increased our knowledge and recognized these things earlier on. Last point on this is that I also go to the prisons. I'm the psychiatrist that goes to the female prison, and before I used to go to Northward. I've seen too many young people that are incarcerated with mental health conditions that were not recognized early, that they were viewed as disruptive, as rude, as bad children. And today we bear the price and the consequence that they're now criminalized and their life has been stigmatized and damaged. We have about, I think it's 20 something, 30 women approximately incarcerated at His Majesty's Prison Fairbanks. Half of them have mental health issues. On a monthly basis, I see about 14 or 15 of them. So that should tell you something about our stats. As I said, brain development. The brain undergoes radical change during adolescence. The parts of the brain that control physical movement, vision, and senses mature first, but the regions in the front of the brain that control our higher thinking, judgment, impulsivity, risk-taking, that's the area of the brain that's developed last. So just add that again to the burden of disease in terms of the incidence of mental health challenges happening early in a brain that's not as developed, in a risk-taking type brain. You can see that the challenges that we have many times with youth mental health and the consequences. All right, so that brings us to the concept of ACEs, or adverse childhood experiences. Again, where we are now in 2024, especially with research that's been done just over the last 10 to 15 years, is that it's given us a greater understanding of what are the social constructs or impacts or influences on our health, on our mental health, and on our general health. And we're finding out that abuse, neglect, and household dysfunction are significant contributors to the manifestation of mental health conditions. So there's a subset of humans that are predisposed, that we may have a tendency in our family to depression or anxiety, or to obsessive compulsive disorders or autism or other types of diagnoses. But our social experience plays a major part, and the experiences that we live and go through. US stats, and this has now been confirmed through other parts of the UK and even here, so highlight that about 6 out of 10 people experienced at least one type of adverse childhood event before age 18. And many times when we hear about adverse childhood events, we think about serious physical abuse, sexual abuse, which are extremely abhorrent and extremely terrible, and probably at the tip of the iceberg. But there's also emotional abuse and emotional neglect. There's physical and emotional neglect, meaning that there are a lot of young people that maybe they were never beaten or physically harmed in any way or necessarily criticized verbally, but they found that they grew up in a household that was quite cold, that their parents were distant emotionally or otherwise. There was not enough engagement or interaction, and that can lead to negative effects later on. Another component of the ACEs I want to highlight on this slide is the section where you see the household dysfunction. And many times that goes unrecognized. That mental illness in a household affects other members of that household in different ways. That abuse towards a parent by another parent or another adult in the household impacts and affects the children and the young people and others observing that or those that are aware of that. Divorce, just the very act of a divorce, and I'm not trying to guilt us out or criticize anyone, because unfortunately or fortunately 60 to 70% of all of us have experienced divorce or will at some point. And blended families are now the norm, but it's important to recognize that that separation is considered an adverse childhood experience, and to what degree or to how much it impacts a particular person or young person, that may be different. Substance abuse in a household and having a parent or a close relative in a household incarcerated also acts as an adverse childhood experience and can affect young people moving forward. Now, as I said, the impact of these adverse childhood events are not just solely on mental health. What we're realizing is that it increases the risk of chronic diseases leading to early death, increases the risk of cancer, diabetes, heart disease, and definitely it increases the risk of suicide. So what we're seeing is that many medical schools are actually using ACE evaluation forms to teach medical students and young doctors in hospitals and so on that every patient you come in contact with, you should get a brief background of their childhood and to assess for these potential adverse childhood events, because that can make a difference in terms of really providing comprehensive care and treatment. It's also important, as I was saying, that it all hurts, these ACEs, not just the most severe and significant of these adverse childhood events, but the other ones like divorce, as we said, and also abuse or neglect. And that there is still stigma, even in terms of how we appreciate the differences of these ACEs, and to say, well, you weren't beaten as a child, you came from a middle class upbringing, you had both parents in the house. What kind of adverse events could that person really go through? And that's really a disservice, because it mutes the ability of one to open up about how they feel, and it negates and minimizes their feelings, complicates their process of their mental health, and it still leads to unfavorable outcomes. So it's important to understand that trauma is trauma, and it impacts us in different ways, but it does have an impact. And it's not our place to judge which trauma is worse than any other trauma. Now, we can turn the tide, as we have been doing over the last 25 years or so, and in terms of putting all of these things in place, in terms of what you're all doing, in terms of listening today. And I want to highlight something that goes missed a lot, and you have to maybe dig a little bit or search a little bit deeper in Google to find that there is also PACEs, or positive childhood events. I like to hammer this home, because what I'm finding here in my office when I see young people and even adults is that we have to be careful of negative overload in our information. And when I say negative, we give a lot of information about all the things we're struggling with, the things we don't have, what we need. We don't have the proper beds. We need more professionals. I was just criticizing in terms of not understanding why we prescribe meds for certain things and all the, but it's important for us to highlight what you can do as an individual And nurturing relationships, providing safe environments, having supportive communities can help to overcome or to put in balance um, the negative and the positive. Strong family bonds, mentorships, big brothers, big sisters, mentoring children and young people has been powerful. Parents, teachers, coaches, mentors can make a major difference. Interesting study out of Stanford University. A psychologist there did some studies about contact, having a mentor or a positive figure in a young person's life, having contact with that young person. An interesting thing they found was that it can be brief. It doesn't have to be, well, I have to spend hours a week and so on. Brief positive contact can also be powerful. Telling a young person, you can do this. I believe in you. I am here with you. How are you feeling? Can be very powerful. Another little quick pearl or tool for all of you is that we hear a lot about what can we do? We need to talk to our children. We do talk with our children. I think what we need to do is to listen more to our children. An old psychoanalyst, a friend of Sigmund Freud, wrote a book that's called Listening with the Third Ear. And it means focusing very carefully into the words that somebody uses and listening to what they say, what they don't say, and their behaviors. And it's very important that we put this into play with our young people. Belonging. Another little pearl in terms of assessing. If you want to assess a young person, ask questions about how connected or belonging or they feel in any environment. Do they feel like they belong at school, that they're part of the environment, that they fit in to some extent? Do they feel that they belong and they fit in their family? Studies have shown that a strong sense of belonging at home and school are two major predictors of positive mental health outcomes for youth. This brings us up to the Inspire that I spoke about. It was last October. And what had happened, as I said, that there was quite an increase of suicides last year. There was a period around this time 1 year ago where we had, I think, two or almost three suicides within about a 2 month period. A young person wrote in to CMR, concerned about what he felt was a lack of recognition, a lack of appreciation by those of us, by adults, in the larger society, of the impact that our young people were going through. And he wrote a very impassioned and frustrating letter about what he felt was happening in the Cayman Islands. And he highlighted the sense that they are feeling, young people, that we're not really listening. We talk to them, talk at them, but we don't really listen and take on board what they're saying fully. And so a group of us at the hospital came together, pushed by Miss Lizette Yearwood, and I want to give her a shout out. She's a very passionate person. She reached out to me and other doctors, and we got together and came up and said, what could we do to address this? We're seeing these young people come in on call. We see them on the inpatient unit. What can we do? So we sat down, we got the ministry on board, and I give a shout out to the chief nursing officer, the chief medical officer, the chief officer at that time. We had a meeting at the hospital and came up, and a lot of people, and I wanted to give kudos to Erin Kaufman, Emily Kelly, Tiffany Miles from DCFS, Miss Marcia Mullings Thompson from Ponciana, Carolina Ferreira, Fiona McDonald from the Mental Health Commission, Shannon Seymour, Sutton Burke, I mean, it was public, private. Everyone came together. They gave their time. They volunteered. We set up this Inspire Youth Speak Out, and it was an overwhelming success. Just last week, Dr. Basson, who was part of this, it went to Trinidad to present data that she got from the young people that gave us a lot of information. So this is something that, again, is a positive and that we hope to build on to show our young people that we care, number one. And number two, and even more importantly, that we can gather information to know what their concerns are so that we can move forward. Going full circle from what I started and talking about where we were 80 years ago and our forefathers recognizing that there wasn't a lot of activity and that there needed to be fairs and different activities put together for youth, they realized that we're social beings, we're social creatures. That's why many of us send our children to school. Yes, some of our kids are homeschooled, but even those that are homeschooled, we try to find activities where they can connect. Group gatherings are very essential for young people. They learn and share positive values. They learn new coping strategies from their peers. They can connect with adults who are beneficial and make other youth as allies. It empowers their voices. It gives them hope for the future, which is their world. There are other things, but so action steps, remember that our human superpower is the ability to work together. That's really one of the things that differentiates us from other animals on the planet is that for the most part, we are able to join and work together for a common good. And we need to continue to realize that. And each and every one of your voices is extremely powerful in that. We need more collaboration. That's one thing that bothers me about the Cayman Islands. We need more collaboration. It's not all in government's hands. We need the private sector. We need the NPOs. We need to come together to make things work, just like what we've done with Alex's place. That was a public-private initiative that's working. We need to have more things like that. We need more places of safety. We need early intervention. We need to relook at our educational approach, especially in the coming world of AI. A lot of jobs are going to be redundant. We need to make sure that our young people are being trained and are choosing the right skills and careers that they can apply in the future. We're at an interesting crossroads where for the first time in modern human history, young people feel that the world that is facing them is less hopeful, less caring, less beneficial than previous generations. So just think back, most of us that are participating in this today, just think back to when you were 15 or 16 and what you were looking forward to, the hopes that you had about what you could be and what you could do. We now have a generation of young people who feel that the world is polluted, that there's global warming, that there's war all around, that their life in terms of cost of living, in terms of their ability to buy a home or to achieve things that their parents or even their grandparents achieved is fleeting and it's far away, and that's sad, and we need to change that. So get involved. Early intervention, that's extremely important. Thank you very much, and I hope there's some questions.
Thank you, Dr. Lockhart, for that really useful and helpful presentation. We are going to open up the floor to some Q&A. But before we do that, I'm going to ask for the Q&A to be, people can raise their hand, speak about it, have engaging conversations via chat that way. But if you want to put your questions in chat, that's absolutely fine. I'm also going to put the feedback survey in the chat. That's the link for everyone to complete because we want to hear from you all to see what we can do moving forward. So the floor is open. So please, whoever wants to share, unmute yourselves or raise your hand and we'll take it from there.
Good afternoon. Can I ask a question?
You sure can.
Good
Afternoon.
afternoon, Dr. Lockhart.
Good
Thank
afternoon.
you for this presentation.
You're very welcome.
I wanted to try to understand what's the barriers to having a inpatient pediatric psychiatric ward.
So there are a few. Number one is cost. Um, and so let me back up. So where we are right now today, I think cost is the number one concern. Number two is finding the space. Number three is the lack of focus and diligence from previous years. And what we should have done was a long time ago develop inpatient psychiatric care for young people and for adults. But again, mental health is always at the in the background. We've had to shout and fight really for recognition and appreciation. There's a heavy stigma, and part of it too is really part of humankind. You have to
Mm-hmm.
remember that the one of the biggest fears that we have as human beings, and just if you just indulge me for a minute,
Mm-hmm.
is the fear of losing our mind.
Mm-hmm.
How many horror movies and scary shows are based on the person that's lost their mind or their how many times do we use that phrase in a day? Oh, that person's crazy, or that's crazy. I can't believe that. That's madness. So those terms, generationally, they're almost in our DNA as human beings,
Mm-hmm.
push us away from dealing with mental health issues. So where we are now, Miss Lydia, excellent question, is that we're in a different world. We're in a world where larger countries near us are focusing on their own. They're expelling people who they don't feel belong. It is becoming more difficult for our young people to go away to do different things. We need to focus on our own. We need to focus on our islands. We need to focus on our residents. When I say our own, people living here and what we can do. Um, a major point, and I touched on it earlier when I said that one of my big pet peeves and concerns about where we are is that I would like our government, especially the new government that just come in, to understand that you can't do it alone. We see the challenges that they have with budgets and so on. Please engage with the private sector and come up with public-private partnerships. I just saw something the other day where I think it's the government of Antigua. The Prime Minister of Antigua is also the Minister of Public-Private Partnerships. So they have a ministry that's set up to assess and to look at which private institutions, private corporations they can work with to match funds to do things for their society.
Mm-hmm.
And I say that because I feel the best option is to come up with that type of an arrangement so that hospital beds in the hospital can be amplified, can be expanded. We have the space at the hospital, but it's really to get the money and the resources to expand and to have the separate section for young people.
Wonderful. Thank you for that.
You
I
are
I also do I have space if for another kind of inquiry?
sure, go ahead.
So I'm curious about whether you feel there's a need for an increase in the mental health programming being implanted into the school systems as a way to give our children the adaptive coping skills necessary to flourish. I'm thinking specifically of the, field of positive psychology with Dr. Martin Seligman and kind of all the work he's done in, California to, do that programming to help curb depression, because obviously by 12 our maladaptive coping is already kicking up. So I'm wondering whether you think having that kind of programming in schools, maybe around 12 up through high school, would actually be an impactful way to positively help the mental health status of our youth. Yeah, if that all makes sense.
You make sense, and I would say I would even go further, Vasily, and say I support that 100%, and I wouldn't wait for age 12. And I think
Mm,
what we're realizing in the world that we're in, when we look at the numbers of young people that are taking their own lives,
yeah.
so I'm not being bombastic. I'm not just being loud and alarmist. When we look at the stats, I challenge all of you right now to go and use your search engine and just look up suicide incidents in young people and look at the stats yourself. Pick a country. US, UK, it's increased. Suicide rates are going up in the UK, Canada, here. So we need to adapt. And I feel that it's not just the mental health teaching, but it's life skills. It needs to
Mm,
start at probably the third or fourth grade, by probably age 9, 8 or 9. Conflict resolution, working on frustration tolerance, having interactions, group activities, planning, having field trips and outside type experiences, learning basic day-to-day life management skills from an early age. How do I catch a bus? How do I open a bank account? What's the purpose of that? How do I save money? What's the point of or the benefits of saving? How do I deal with criticism? And all of these things can help to reduce things like stigmatization and bullying and other types of conflicts later on. Many years ago, in the 1970s, we used to have health. It started with classes where you had to have a health class. And that was because we realized that it increased the knowledge of basic hygiene that lowered communicable diseases. We need to start and amplify that to help with coping. And as you said, the positive psychology, building resilience is extremely important. And there are lots of interventions that we know that are available to assist and help with that. So I agree, we need to look at our curriculum and see, is it really appropriate to our environment and to the world that we're now living in?
Thank
Lydia,
you.
hi, it's Renee. I'm just going to jump into here. When it comes to having that emotional literacy, I will say that APF does that with all public schools and some private schools as well. We do have our emotional literacy programs starting from ages 5 and up until like I want to say about 12 years old. So that's something that has been embedded into the public schools, and that's something that we're growing further as well. So I just want to put that out there too. Okay.
Yeah.
So
Thank
there
you. Thank you.
is
I'm aware. Yeah.
okay. Okay, good.
Yeah. Thanks.
And let me highlight that, because I should have mentioned that, and we're all aware of that, and that is wonderful, and that's exactly what I'm saying. It took APF, a non-profit organization, a secular organization, to initiate things like that. Yes, the ministry is supported, but that's what I'm saying is, remember, we the people are the ones that run and form governments. We're the ones that lead. They follow. We have to continue to do things like this and shout loudly for them to hear, so that things like these initiatives are expanded and supported.
Isadora, I know you had your hand raised for some time, so you can go
Oh, hi.
ahead.
Thank you. Thank you so much. Firstly, thank you both for putting this on. This is absolutely amazing. And I'm actually studying to become a trauma-informed coach. So that was one of the reasons I got so interested in this lunch and learn. But most of you would know me as someone who sings a lot to children. I do sing-alongs, etc. And I was wondering, is there a way that this could be incorporated to allow people to become more trauma informed? Because I think if they understand from the get-go, we can actually really help the little ones so that they are equipped with all of those skill sets before they even have to be stumbling. But maybe I'm overthinking, or I don't have the knowledge. So I guess it's partly a question and partly a statement. I'd love to hear your thoughts, Dr. Lockhart.
So, Ms. Isadora, thank you for that. And um, that ties into what we're saying about the recognition of adverse childhood events and the positive childhood events. So not just to keep hammering on the negative, that having those interactions, positive interactions, setting positive examples, um, are extremely powerful. And the earlier the age that can be done, the better. And so you're 100% right. And organizations just like this, like the Alex Panton Foundation, that's just been tremendous. And other NPOs are extremely valuable. And continuing to support these types of outlets and these types of discussions are key to reaching parents, because again, it's very important that our focus is on each individual, spreading the word, letting people know that there are things that you can do, that while it may seem overwhelming and oh my gosh, another young person has lost their life and it's just, there's nothing that we can. No, there's a lot. Yeah, even if it's touching a young person, as I said, there are these studies out of Stanford that show that minimal contact, minimal positive contact can be very powerful. And think back, many of us can remember a teacher saying one thing or two things to us. And say, wow, I never forgot. I felt this way. And this person, a person we looked up to or so on, told me this and that. And I never forgot that statement. It was just so powerful how it made me feel. There's a sign I have right here in my office by Maya Angelou, and it says, people forget what you said. People will forget what you did, but people will never forget how you made them feel.
That's accurate. Yes.
So thank you for that.
Thank you so much. I appreciate everybody as well who took their time to come out, because just that energy alone shows that there is compassion out there and people want to help and be involved. So
yes.
Kudos to everyone who attended as well.
Yes, please. You don't know how this is.
Good afternoon, Dr. Lockhart. I have no idea why it is that I can't put my hand up. I actually attended 2 sessions with you at the HSA from the Behavior Support Services. So I work directly with the very young students.
Yes,
I just want to make 2 little my opinion to really say.
Yes.
The first thing is that I think there's still that stigma attached whenever somebody says mental health. And I see it every day when kids are referred to me and the parents come and you start to talk to them about, what was the diagnosis, what did the ed psych review say, and the parents, they kind of take a stand back from the time you start to explain things to them. And then the next part I want to say is that I bounce my head against the wall every single day when I'm trying to get help for my kids. Every single day. I probably have big marks on my head. And you would know what I'm talking about because one of the cases you mentioned, right?
Yes.
And it hurts my heart because I am saying that I would say, and I'll probably get whipped for this, but those that make the decision, the people that are in authority, they are the first ones we need to educate about kids with mental health diagnoses. Because you look at some of my students on the outside, they are beautiful. They look like any other 9 and 8 and 7-year-old, but inside of them is where that turmoil and the trauma and everything is. And you cannot see that from the outside. So the people that make the decisions, they just hear mental health, but they're not aware of it. And there are quite a lot of people that have absolutely no idea what it is like, what these kids are going through. And if they would only know 1% of the struggles that these kids have, they would open those doors and get things in place. Because as far as I see it, we're going to have a missing generation if nobody takes grip of these young Caymanian kids. And they were saying, yes, we're looking after Caymanians. Let us put our feet as we talk. And yes, let's do something for these kids. Because I am telling you, they are being left by the wayside, as you know. And, it's just, there's a lot to be done. And like you rightly said, I agree with you 100%. We have to do it together. And it's good that I see so many people on this live that you did here, and it was awesome. Listen to me, it was just awesome today. And thank you very, very much for all that you do behind the scenes.
Thank you. Thank you, Ms. Susan. I couldn't say it any better. Another thing is, we need to grow thicker skin. I love the Cayman Islands. I'm not going anywhere. I already bought my plot up in Northside where I'm going to be buried. I love this place. I don't criticize and tear down to tear down. I'm not trying to tear down. And it pains me when I make a statement that we need to do more or the government is not doing enough, and then somebody throws an arrow or makes a veiled criticism against, like, almost like I should shut my mouth or something. I'm not going to do that. And it has nothing to do with tearing anyone down. We need to build up our community, build up our youth. And those of us that live it, that work it, that see it every day are the ones that need to talk. And not just those, the parents, those of you that are parents and see your children, you hear the stories. So I commend all of you that are here, and I say, I want to empower you. Any comment, any little thing that you can put, a brief comment on your Facebook, on your different social media, a statement to a young person, an uplifting word, a word to your politicians about mental health issues, so that we can break down that stigma also, that word is not a bad word. We all have mental health challenges, all of us. All of us in different levels have had stress or anxiety or experienced different aspects of things. It doesn't make you weaker. It actually makes you stronger to identify that. So I support you 100% with that.
Thank you all so much for attending, as it was said earlier, and for your questions. Dr. Lockhart, do you have, because we do have some questions in the chat, do you have time for one more question?
Yes, I do. And then I wanted to also make one quick statement before we wrap up.
Okay, so the first question in the chat was by Colleen Williams, to my knowledge, and it says, could you speak about any correlation between the COVID-19 pandemic lockdown policies and the increase in mental health issues, particularly for younger persons? That's a loaded question. So a quick synopsis of that, considering the time.
Quick synopsis, that we could have a whole topic on that, and I think we will. I remember it was at an Alex Panton Foundation talk, I think I can't remember if it was this right after the first year of the pandemic, something like that. And we spoke about all the stats that we were seeing about the impact that it's going to have. I still see the impact today. Not a week goes by that I don't see a young person, especially in the age group of let's say about 18 to 23, 24, that's not been affected by that. I have young people that have not graduated yet from university. And a lot of that disruption was still a residual from that pandemic. It has left a scar. And we talked about ACEs. One of the ACEs of this 21st century, the first part of the 21st century, was the experience through the pandemic.
Yes, you're absolutely right. That still affects so many people. Even if we don't acknowledge it, the effects are still there, you know? So I know we're gonna wrap up now. I know we have a few questions in the chat. I did mention that for those questions that did not get answered on this call, please send those questions to edu@alexhansenfoundation.ky. I will put that once more so you have it there. So we'll do our best to answer those questions as well because we want to make sure that you know those who are inquiring about certain things get the answers for that as well. So we're wrapping up now. And Dr. Lockhart, you said you had a statement that you want to share before you go?
Yes, so on the 6th of June, last week, the European Healthcare Design Organization in London, they're part of the Royal College of Physicians in London. Every year they have a European Healthcare Design Awards program. And this is a worldwide organization and program that looks at the architects that have designed different types of healthcare facilities submit their drawings, their proposal. It's a presentation. It's very competitive. And in the area of mental health design, the Ponciana Rehabilitation Center of the Cayman Islands won the first prize worldwide under mental health design. The design of that facility beat out a facility in London, another one in New Zealand, and in the Netherlands. So the effort, the energy that I and many others put into designing that facility and the criticisms that we took from many who said it wasn't needed, it's overdone, why are you building that type of facility, why you chose out there in East End, and so on. I feel that that has now been vindicated, where this facility was just given this award as the #1 designed mental health facility in the world in this competition just last week.
Wow, that is amazing. There's so many comments in the chat too, just saying how fantastic this was. And Miss Jane said, thanks in large part to you, Dr. Lockhart. So thank you for all the work that you've done and continue to do. And yeah, so if
but there are many, many others. You can't do it by yourself. It takes a village. And
absolutely.
I've pushed. I am so happy. There's so many on this call. Many are participated that help with this. So this is us. This is us as a community. We should feel proud of this here in the Little Cayman Islands, that our facility out there beat out the Netherlands, New Zealand, UK. And you can look it up online. It's called you just look up European Healthcare Design Awards, and it's there.
Okay, I'm taking note of that myself, to be honest. So thank you so much for that. So thank you everyone. We are past 2 o'clock. It's 2:10. This is a conversation that we're pretty sure could have went on for another hour, but we want to be mindful of everyone's lunch hour. So thank you all for joining us again for this Lunch and Learn, very informative Lunch and Learn, and we will keep in contact and promote the other Lunch and Learn in July to come. So thank you once again so much.
Thank you all. Thank you all.
Thank you. Thank you again, Dr. Lockhart.
You're
Bye.
very welcome. Thank you, Ms. Renee.
Bye.
Thank you, Dr. Lockhart. Thank you very much.
You're very welcome, Ms. Felicia.